You know, you'll hear a lot of experts talk about the virus, talk about the shots that everybody's supposed to get when it comes to COVID. But the guy we have with us now, you probably know, Dr. Harvey Risch. He's an epidemiology professor at the Yale School of Public Health. So this is his specialty. Now, he's the guy who I guess we first heard of during this pandemic because he said hydroxychloroquine works. It's easy. We have it. It works. It will help, get rid of a lot of this stuff. I know that I took hydroxychloroquine when my family had COVID, everything else. I never got it. I stopped taking it. 6 months later, I've got COVID. I think hydroxychloroquine was a miracle and at least something that would slow things down for a lot of people. But who am I to say? Dr. Harvey Risch is here with us now. Hi, Doctor. How are you?
Good morning. How are you?
Good. Thank you so much for speaking out, whether you're right or wrong, speaking out about the things that you believe in and not bowing to the pressure of this new weird science rule that we just don't question authority. Let me talk to you about the vaccines. I get so much heat because I've had COVID. I'm not interested in getting the vaccine. I'm not an anti-vaxxer. I don't have a problem with the vaccine. But I know my kids are young. I'm not going to give it to them. And because I don't think I think there's too many questions out there about something that is brand new that we've not had, trials on. If they needed it, my parents, I would give it to my parents. I encouraged my parents to take it. If I were a little older and more frail, I would take it. I'm called insane for having those standards. Am I?
No, you're completely rational. And when people are calling you names instead of debating the science, the tables have flipped. The science, the real science, the evidence is what matters. And we know a couple days ago, proof of exactly your understanding has been written in an article from Israel where they actually looked at some 7 million people and their experience from taking the vaccines or having had COVID or being unvaccinated and not knowingly have had COVID. And what they found is that there was equal protection from getting COVID either a second time or after vaccination from people who have been vaccinated as the same as people who've had COVID in the past. And so, this means that their protection from COVID is just as good. It's 90% or higher than the same as the vaccines from getting COVID.
So then why is everybody pounding on? Nobody seems to be paying attention to what we have going on in Israel. We have a population that has vaccinated. They have herd immunity now, and we're seeing different kinds of results. We have the facts. Why isn't anybody talking about this?
Well, because I think there's different motivations than just vaccinating people for their health benefit. I think we are in a mania. There's no other way to put it, that people are convinced as a matter of their religious assumptions that vaccination is their creed and it's a mania that there's no discussion, there's no pros and cons, that the cons don't matter no matter what. I think that what's more interesting than Israel even is United Arab Emirates, who've also vaccinated 60% of their population with essentially the same vaccine, the Pfizer vaccine. And I think their experience is more realistic, that what one sees is the mortality come down quickly, but the case numbers not. The case numbers came down, but much more slowly. And that is what's to be expected from vaccination. And that's why, even though we've been vaccinating a lot in the U.S., that there's still cases occurring, and we do have herd immunity in many states in the U.S., but it will be slow, and that doesn't matter. And as I've been saying for the whole year, it's not the cases that matter, it's the people who are hospitalized and the people who die from the disease that matter. And people are just freaking out.
Because that's what separates. Right, that's what separates this from the flu. is how bad it gets for so many people and how many people would die from it compared to the flu. But if you get it and you're sick and you're home and you stay home for a couple of weeks and you don't have to go to the hospital and you don't die from it, then it's just the flu.
Well, a couple of weeks would be enough to put a big dent on people's economic viability and so on. It should be a couple of days. And,
Right.
we've got half a dozen or more medications to be used to treat this for outpatients when they're treated in the first few days. And they all work. They all combine. They're very effective. We know they're effective for the Brazil variant. The Brazilians have been using them and have found them effective. So we know how to manage this, and we've known how to manage it for a long time. But, of course, can you think of any other drugs, any other approved medications that have been blocked or prohibited by medical societies, medical regulatory agencies?
No. That's especially like if you're talking hydroxychloroquine especially, that's been out forever. Forever.
Right.
We know exactly what it is.
So the fact that there's interference in a drug that is safer than aspirin, that has been used for 55 years in tens of billions of doses, the fact that there's pushback and formal government and medical interference in that, there's no explanation other than a nefarious reason. There's no health explanation.
So I could dismiss a lot of the things that were happening at the very beginning as, we didn't know what we were dealing with. Do we know what we're dealing with now?
Pretty much.
Okay. Does it ever become something that we're, because I said at the very beginning, that this is probably going to be something that we have to deal with for the rest of our lives, like the flu. But if it is even has the same rate of death of the flu, that's doubling that. And it's a big number. So it's not something you want to do, but it's going to be with us forever. And it's going to be like the flu. Does it look like we're headed in that direction? Is that what are we going to deal with this for the rest of our lives?
I think that there's two things. First of all, this is when children are affected, it's a cold. For almost every, 1 in 10,000, it may be more serious, but by and large, for almost all young children, this is nothing worse than a cold. If they spread it to each other, it's unusual. Mostly they get it from adults, and they develop T-cell immunity, and they're protected. We've only known about it for 15 months or something, so it's hard to know how long anything lasts. But the evidence is that T-cell immunity will be long-lasting. We know that T-cell immunity from SARS-1 is now 17 years old, and people who had SARS-1 still have T-cell immunity from that. So it's likely that children will get it. It'll be a cold-like illness, and most won't even know it, and it'll go away, and that'll be the end of it for them as they get older in life. It's we adults who have to deal with it now when it gets entered into the population as an endemic disease, which it is. So we have a transition period to get through it that children, especially young children, will not have. And I think the long-term characteristic of this will be over the next 20 to 30 years when each new generation of children hardly notices that anything's happening, whereas the adults, have to deal with it one way or another, and whether it's vaccination, whether it's getting the disease, whether it's prevention, whether it's treatment, all of those are possible ways of dealing with it for the adults.
Is there any reason that you can see that Texas and Florida and places that didn't lock down are doing better than the places like California and New York? Why is that happening?
That's because lockdown is counterproductive. At the very beginning of this, when we had no idea what was going on, lockdown was useful in order to give us time to figure out how to manage it, how to keep the hospitals from overflowing right at the beginning. But after that point, once the disease is endemic, there's no point because all you're doing is prolonging the inevitable. The disease is endemic. It is in the population. It will grow to the degree that there is no herd immunity. So the states like North Dakota, South Dakota, Texas, Arizona, Tennessee, that didn't lock down or didn't really lock down, that have let the infection go and occur in young people who are mostly unaffected, or if they get it, it's a mild disease and they recover pretty much perfectly well. If not in a couple of weeks, then a month or two. Then what you get is you build up a lot of herd immunity. And so we had herd immunity in North Dakota in October, and in South Dakota in October, November, and so on. And so those peaks have come down dramatically. Same as Texas and Florida. The amount of herd immunity that's built up is quite large. And once that happens, and herd immunity is not a function of vaccines. Vaccines contribute to it, but so does natural infection, and most people are asymptomatic. So they built up the herd immunity, whereas California didn't.
So is the idea that once you get the vaccine or once you've had it, that you still have to be quarantined, or you can't go out for 4th of July, or you have to wear masks? That's bullcrap, isn't it?
Well, so this is a subtle thing that I don't think was well recognized, and that is that just like masks, there's the benefit for the person and there's the benefit for the bystanders, the people around the person, and that's called source control. And what we've heard, that the manufacturers' randomized trials for safety and efficacy only examined benefit for the people who were vaccinated. And that benefit is between 60 and 90%, and generally tending towards the 90% for most in the vaccination trials. But what they didn't evaluate is how much vaccinated people do or don't transmit the infection to others. And this is why I was saying the United Arab Emirates, their data shows that, in fact, transmission is not benefit quite nearly as well as vaccination for the person. So the vaccines cut the individual's risk by 90% of getting COVID, but they only cut the risk of transmission by 50 to 60%. And that's why the case numbers go on for a long time, even though the mortality goes down. And I think that's really, we've been sold the idea that if these vaccines prevent the disease by 90%, then why can't we just go out and have normal life? And the answer is because they don't prevent transmission nearly as much, and so it will still spread. Now, spreading, is, as I said, is not necessarily bad. If the people who are at high risk, who will do poorly if they get it, are adequately protected, either by vaccination or early treatment or prevention with hydroxychloroquine, ivermectin, other medications, if they're adequately protected, then the society reopens like normal. Our schools should be open. Day camps should be open, because that is how you get herd immunity in safe, natural, protected ways. And you protect high-risk people by keeping them basically separated to a certain degree, as well as having vaccination and prevention and treatment. And I think that's the whole way that we work out of this.
Doctor, it is a pleasure to talk to you. Thank you so much for the work that you do, and keep your spine. You are an inspiration to a lot of people, that you are willing to take the hits from your own circles. Thank you for that, Dr. Harvey Risch.
Great
go ahead.
To talk to you. And I was just going to say, nature, speaks to us through science, and I don't consider that nature lies to me. Nature tells the truth. I just have to be open to listening to it, and I'm just a messenger here.
Good for you. Dr. Harvey Risch, epidemiology professor at the Yale School of Public Health.